Good afternoon, everyone. Happy February. Here we are, February 2nd, and I'm Lori Mance, and I am the founder of Dementia Training for Life, as well as the Rhode Island Memory Cafes. And we started last week with a new live series offering some training and education so that people understand, and so we can break down some of the stigma of dementia. So last week we talked a little bit about what is dementia, and I know that there's lots of explanations, but I wanted to review that. But then we're going to go into person-centered care and why I feel it's so important that people understand this. So I'm sure if you're living with or caring for someone with dementia or a professional that provides care, you've heard the phrase, when you've met one person with dementia, you've only met one person. Well, that's absolutely true. No matter what the disease process is, it still has an impact on that individual all its own. Everyone's brain is different. Every person is different. Therefore, how they respond and react to the disease and the stimulation around them and their wants and needs are all different. So that's what I really want to talk about, because one of the things that concerns me, I'm on many different support pages on Facebook and providing input. I see a lot of people say, well, my mom has dementia and this is what she's doing. Have you seen this? It's like, yes, we do see similarities, but my concern is when people say, what medications would you use for this? And that's a whole different ballgame. And that's when we really have to get our professionals involved, because the brain is only one part of the body that gets affected by medications. So I'm not a doctor. I am an occupational therapist. I specialize in dementia care, and I'm a trainer. So let's jump in a little bit and see if I can bring some light to what is this thing called person-centered care. Okay. So last week we talked a little bit about what is dementia. And again, I want to repeat this. Dementia is not the disease. Dementia is the symptoms or the side effects of different diseases. Actually, over 120 different diseases that affect the brain. What dementia actually is the loss of cognitive function. And for a person to be diagnosed to having dementia, at least 2 areas of cognitive function must be impaired to the point where it's interfering with your day-to-day life. And it can be any of these things, as well as more, these different skills that you typically see with the brain or abilities. And one person with dementia, with Lewy body disease, may be very different than another person with Lewy body, or somebody with Alzheimer's compared to another person with Alzheimer's. So it's really important that we recognize that dementia, again, is not the disease, but it's the symptoms of the disease. And the way I like to express that is that if I said to you I had a runny nose, a scratchy throat, and a cough, what do I have? Well, I have the symptoms of either a cold or the flu or allergies or maybe even COVID. And it's really important to know what are causing those symptoms in order to treat it properly. And yes, in dementia, we do have treatments. We do not have any cures, but we do have treatments. And our treatments come from the way we interact with individuals that are living with the diseases, and how we adapt the environment, and how the expectations and the systems that we put into place to allow those individuals to be as independent and have a purposeful and engaging and enjoyable life well into the disease process. So, well, person-centered care, as we know, you have 10 people in the room, no two people are the same. Well, you can have those 10 people in the room that all have Alzheimer's, and they all present differently, because every person is different. So it's important that we understand the impact of those differences and how much our knowledge of that person's life history and experiences and likes and dislikes impact their well-being. So person-centered care is recognized by the Centers for Medicare Services and the World Health Organization. And what our medical model used to be was that there was a specific process for every disease diagnosed. There's a very specific routine that you follow when you treat it. But when it comes to dementia, it's very different. And we now know that it must be person-centered. And that person-centered means that it is driven by and the wants and needs of that individual are the most important things that we look at. So person-centered care promotes positive well-being. It honors their choices. And one of the reasons why I really, really push for early and accurate diagnosis so that the individuals living with the disease can make their choices known early in the disease process so that others can follow their wishes. It enhances their dignity, absolutely empowers them to be as independent and purposeful with their life. They drive it, okay? It improves quality of life and it supports that independence. So if we follow the person-centered care model, then we allow individuals to be more independent and to have more joy. The 4 principles in person-centered care is that we have to treat people with dignity, compassion, and respect. Now, obviously, we want to do that with everyone we care for, but there's been a big push for people recognizing that we have to call people by their chosen names. Now, my grandfather's given name was Cecil, but you never called him Cecil. His chosen name was CJ, and that's what he wanted to be called. We have to be careful. I don't know why, but now constantly going through Dunkin' Donuts drive-through, I'm getting called Hun, and it's like, yeah, no, I'm not your Hun, and neither are your loved ones or the people that you care for if you work in this field professionally. The second principle is that we have to provide coordinated care. And in the old method of providing healthcare was a doctor was doing his work and taking care of the things that he needed to do. And then we would meet with the therapist and the therapist would take care of what they needed to do. And then the case manager and they would take care of what they needed to do. But when it comes to dementia care, it needs to be well coordinated from one member to the other. And it truly, truly takes a team being driven by the person that's living with dementia, okay? We have to offer personalized care, support, and treatment, whatever that person wants. My daughter knows that when I get this bloody disease, she better not play rap music. Rap music and I don't get along. So it has to be very personalized. And we have to enable individuals to recognize and develop their strengths and abilities well into the disease process. We know that people living with dementia can still perform tasks, maybe in a little different way. We have to learn to adapt. We have to adapt our environment and adapt how we interact with the individuals and maybe even adapt our expectations. But But the most important thing is providing opportunity for people to engage in their life as fully and completely as we possibly can. And one of the best models for that, I will show you. Let's take a look at two people, okay? And how is it that two people with the same diagnosis can be so different, okay? So first person that we have here is a woman, and her name is Mary. And Mary is 74 years old. She's Caucasian, non-Hispanic. She's married. Her ethnicity, she's French. She came from Paris. And she's currently living at home with her husband, and she has 2 adult children. And she's diagnosed with neurocognitive disorder due to Alzheimer's disease. Okay. And then we have a gentleman whose name is Jose. He's also 74. He's Hispanic. He's divorced. He's Latin American and comes from Puerto Rico. He's living at home alone with no support. And he also has a neurocognitive disorder due to Alzheimer's disease. Now, it's really easy to take a look at this and say, how are these people the same and how are they different? Well, the only things that I see that makes them similar, not even the same, but similar, is that they're both 74 years old and they're both living with Alzheimer's. But we're dealing with a man and a woman with different ethnic backgrounds and different traditions and different lifestyles and home supports. But what else could be different? Well, let's take a look at some comorbid conditions. For Mary, she's healthy. She doesn't have those comorbid conditions. But for Jose, he has diabetes and hypertension. And how his Alzheimer's is going to be managed is going to be very different because of other conditions that he may be living with, okay? Occupation, well, she was a nurse. And he was a business owner. So the things that are important to them, their skills, their abilities are very, very different. And the way that we provide them with an ability to be engaged and purposeful may be very different because she may like to be providing care for something or someone, and he may like to be involved in graphs and data and information. So again, these people are going to be very different. And what are their interests? Well, she has hobbies in gardening and sewing and baking. And he has interests in sports and guitars, playing guitar and cars. So yes, both people are living with Alzheimer's disease and both people are 74 years of age. But we're not even talking about the stages within the disease, but they are very different people. And how we approach those individuals and how we support them is going to be very different. When we look at working with people with various different neurocognitive disorders, we must make sure that we're taking into account their habits and their routines, if they've had any traumas, because different events and different sounds, different smells, different surroundings may set off a PTSD or a flashback to a previous trauma. What have their life experiences been? What are their likes and dislikes and their personal preferences? Again, what's important to them? And it's important that we adapt our behavior and our approach to meet those needs. I love using Maslow's hierarchy to take a look at how do we provide care for individuals living with dementia. Now, typically, what happens, particularly when people live in assisted living in nursing homes, we center in on that foundation of safety and psycho and physiological needs. So things like food and warmth and safety and the health needs of that individual. But then we don't get into some of the higher needs. But guess what? People living with dementia still have those needs. And it's really important for us as care providers to try to provide those opportunities to reach those needs and actually have purpose. I'm working with a new woman who is pretty advanced in her dementia, but was told that when you come in that she really can't do much. She just sits and she's still able to read. She just can't remember what it is that she reads, and that she's incontinent, and she's still able to feed herself. Well, I'm happy to say that she actually is not incontinent. We were able to help her become continent with timed toileting, and she's now dry and clean and aware of that. And we made scratch blueberry muffins the other day, and she had a ball. So it just depends on how we approach the individual. And as I said, she's very advanced in her disease. She's probably a stage 6. And every person is different. But I know that we have to change the way we think about how we're providing care in order to make sure that we can encourage people to be as independent and engaged for as long as possible. So I want you to think about, what is your purpose in life? Is your purpose to be with friends, which unfortunately right now with COVID, we can't be like we used to? Or is it caring for someone? Or is it travel? Or is it family? Whatever is your purpose, think about your loved ones and the people that you're providing care for. What is their purpose? We still have to have a purpose. We still have to have a reason to get up in the morning and be engaged and participate, because the longer we can keep those skills, the more independent we can be. So it's just food for thought. I wanted to share with you my ideas about person-centered care and how too often I think we underestimate individuals' abilities. We have to tap into their skills, and we have to tap into their strengths, and we have to tap into their passions in order to bring them joy every day when it comes to living with dementia. So I am available for training for staff in hospitals, nursing homes, and assisted livings, whether that be virtual or in person. And I'm also available for people at home. I can provide direct support to you and your family, either virtually or if you're local, here locally. They can also help you problem solve. And that's one of the things I do pretty good at, that I'm pretty good at. So if you have any questions or concerns, I'd like to open it up to you, and whether it be about person-centered care or any of your own personal question, because I want to make this also an opportunity for people to have their own needs met. Okay, so Ben, how we doing?
We're doing good. We don't have any questions at the moment.
Okay.
But I think that this was a really, really powerful presentation. And I think that, individual care, like I love if you've met one person with Alzheimer's, you've met one person with Alzheimer's. I think that can't be stressed enough. And I know that it's very simple, but it's powerful, and it deserves to be said over and over and over again, because everyone is an individual, and everything is everything needs to be individualized. And I thought that when we had the questions last week, we talked a lot about Lewy body, dementia with Lewy bodies, whichever way you want to say that.
Mm-hmm.
And that's something that my mom had, and my
Mhm.
story was so different from the 5 or 6 other people in the chat that also were going through that with a parent. And you know, every individual is different, and that is so important. So I just think that advocacy is great. um and yeah, what are what are some of the downfalls that you've seen as far as, and if you have any questions, put them in the comments. And if you don't have any questions right now, that is completely fine too. We don't need to we don't need to stay here all day. You can always
Yep.
throw Lori an email, Lori at dementia training for the number 4 life.com. And I know that she would be happy to help you guys off air as well. I know that I know this is a sensitive subject, and sometimes people don't really want to talk about it live, and so if you have any questions at any time, if there's ever, because Lori's going to continue to do this show on Tuesdays, and so if you have questions and you don't feel comfortable, you can always send them to Lori at dementiatrainingforlife.com, which I think is really, really important. So what are some of the blanket treatments? What are some of the pitfalls that you've seen of not having individualized care?
Well, thank you, Ben. That's a great question because
Thanks.
what I see is that too often there's a knee jerk reaction to someone having some cognitive impairment, whether that be memory issues or having falls or having a tremor or having whatever their symptoms are. Way too often, there's a knee jerk reaction to say, oh, it's Alzheimer's. Or even worse, oh, they're just getting older. It's just part of aging. And that's
Mhm.
not true. This is not normal aging. We are dealing with disease processes, over 120 different diseases that can cause dementia at any age, including at birth. So it's not just an elder's disease. We have people, unfortunately, now that are being diagnosed in their 20s and 30s with Alzheimer's disease.
Yeah.
And we typically see much younger when it comes to frontotemporal. So the biggest concern that I have is everybody thinking, well, it's all the same. So give them Namenda and give them Aricept and just make plans for end of life. And that's not true. Life doesn't end right after diagnosis.
Right.
Still so much that you can do. I actually had the wonderful experience of meeting with some people that pre-COVID took people on cruises that had dementia. And the cruise was set up for caregivers and those living with dementia. And they had caregivers on board, and they would see people stand up and dance and all of a sudden start singing that they weren't doing before. And I really think part of that has to do a lot with depression and has a lot to do with feeling like you can't. Whereas
Yeah.
when we encourage them to what they can do, we see people bring new joy and new life to every day. So,
Yeah. Yeah. I think I learned so much doing the Alzheimer's Association of America conference that we did. I learned so much during that, especially that one chart that had the bookshelves,
yes,
and sort of explained how memory loss happens, and that it's
yes,
not the hippocampus is usually the last thing to go. So emotional memory is still there, and then the emotional feelings of things. So when you treat people like they can't do things, uh, they might not they might not remember what they ate for breakfast yesterday, but they still know they still know how you're treating them. And I think that was something that was eye opening for me. You know.
I hope you don't mind this, but I'm gonna correct you with one thing.
Please,
The
please do.
hippocampus,
Please do. I don't know what I'm talking
the
about, Lori.
hippocampus is related to the memory. The amygdala
The
is
amygdala.
related to
The
emotion.
amygdala.
Yes, the
Thank you.
amygdala. So you're welcome.
I knew it was one of
So
them.
yeah, that
I'm gonna
part.
make a song about it so I don't forget.
There you go. Um, but I know that the hardest thing in the world for people to experience, and I've went through this with family members, and I've been dealing with hundreds and hundreds of families with these diseases, um, is when their loved one doesn't recognize them.
Mhm.
And I try to get people to understand that they do know who you are. It's just their brain is now functioning back when they were like 20 or 30 years old rather than 80 years old. And their 80-year-old spouse doesn't look anything like he did when they married at 25 years of age. So
Right.
when they're looking for their husband and they see this elderly man standing in front of them, it's not that they don't know who he is, it's just that they're not recognizing his image at that point, but they know who you are. And I love the phrase from Maya Angelou, is that I may forget what you said, I may forget what you did, but I'll never forget how you made me feel. And that is
Absolutely.
absolutely true for people living with dementia, is that they know how you make them feel. And if they feel valued and respected and allowed to still be the individual that they are, um, that maintains the quality of life.
Yeah, absolutely. Well, thank you,
So
Lori. I don't have any more questions for today. If you guys have questions that you would like to ask Lori and you didn't get a chance to today, you can do it at Lori at dementiatrainingforlife.com. Lori, is there anything else you'd like to cover?
I don't think so. Thank you, Ben.
Thank you, Lori.
I appreciate it.